Welcome to this introduction to the TRACC model. Mastering the use of TRACC is a crucial competency for all our rehab staff. Let's do it. First, let's assess your knowledge of TRACC before the training. Every member of our rehabilitation team must be an expert in TRACC so that we use the same standard language in all our communications among members of the rehab team. This team includes all therapists, physicians, other health professionals, and most importantly, the child's family. In doing this, we will teach and guide our families through the rehabilitation process using TRACC. To complete this course, you will need to visit all the sections, answer all the embedded questions, and pass the final assessment with a passing score of 80%. We recommend that learners follow the learning path by moving through the course using the Next and Previous buttons. If at any time you would like to review any section, use the navigation menu located on the right-hand side of the screen. Our mission at Nicholas Children's Health System is to provide hope and promote lifelong health by providing the best care to every child. Our mission for the rehabilitation services is we provide hope to children and families. We serve in order to achieve the child's maximum potential. Let's start by discussing what TRACC is. TRACC is the service delivery model for rehabilitation services at Nicholas Children's Health System. TRACC is an acronym for Tracking Rehabilitative Advancement Through Accountable Care. We developed, introduced, and launched the TRACC service delivery model in 2012, and we have been using it since. TRACC is even embedded into our PEDS documentation. So what does this mean for us as therapists? So this means that we're in a child's life in different capacity throughout the time that we care for them. These are called episodes of care. So our intervention for each child changes across the childhood based on the child's needs and how they fit best each TRACC model. For example, initially the child may have more intensive and more frequent therapy. Later on, the child may have less intensive and less frequent therapy. Just like sometimes intensity and frequency will increase or decrease depending on the need, sometimes therapy will be stopped or discontinued for a while. Communication between the rehab team, the family, and the child are essential and ongoing. The best track for the child and episodes of care are decided together. So that means that we're always here, and we're here to provide guidance, hope, and the best intervention possible. What is an episode of care? It is the managed care provided for a specific problem or condition during a set time period and can be given either for a short period of time or on a continuous basis. Or it may consist of a series of intervals marked by one or more brief separations from care. What is the role of the therapist in coordination of care and discharge planning? 1. We work together with the patient and the family in all decision making throughout all the episodes of care. 2. We develop a plan, changing or ending services based on the patient's needs, goals, and performance. 3. We change the intensity and the frequency of services provided to the patient according to the TRACC model. This means that the entire team and family are on the same page with regards to decisions and communications. Additionally, the therapist facilitates and eases the changes through the TRACC model with the patient, family, team, and others. We end services when patient has reached maximum benefit, goals or outcomes of therapy have been achieved, patient is unable to continue progress towards goals, or the therapist and team decide that the patient will no longer benefit from skilled therapy. We provide a list of recommended community resources in preparation for discharge. Now let's review how TRACC was developed. The Rehabilitation Service Management Team identified the strengths, weaknesses, opportunities, and threats of existing models of care by conducting a SWOT analysis, therapist interviews, and analyzing patient satisfaction survey results. Then, challenges to the use of service delivery models were noted. We noticed that there were three main concerns from the families. The first concern was the families wanting to be involved in the treatment plan and goal setting. Secondly, they wanted complete and clear discharge instructions. And thirdly, they wanted to be kept in the loop with regards to the progress towards the patient's goals. Click on each number to learn more about the concerns from the patients, families, and the healthcare team. The belief that a child should receive services as long as the family wants them. Results or progress are not well documented. Different frequencies of care for children with chronic disabilities. Services may be temporary or child may not require intervention. Parents and therapists may not agree on focus of intervention. Changes in reimbursement due to healthcare reform. So what were the goals to develop TRACC? We needed guidelines for creating a plan of care. Recommendations for type of therapy, frequency, and duration of therapy. Standardizing care for patients with similar therapy needs. Informing patients and families about the focus of therapy and how decisions are made regarding care. Teaching patients and families about changes in frequency of therapy. Embracing the family as active participants in carrying out a home program and active member of the interdisciplinary team. Now let's learn the key concepts of the TRACC model. Recommendations are based on the therapist's professional judgment. Findings reflect the therapist's opinion on what is best for the patient regardless of limiting factors. Service delivery models change over the course of episodes of care. Patients may be moved through different models in order to optimize a child's functional results. Discharge planning begins on day 1 of therapy services. Decision-making for discharge is based on progress towards goals and the child's response to therapy. Goals are functional, measurable, meaningful, and appropriate to the child's needs and expected results. Frequency determinations are based on objective findings related to therapeutic prognosis and functional gains or changes in skilled therapy interventions. This requires working together with the child, family, and interdisciplinary team to identify goals and best track for the child. What are the frequency guidelines for decision making? Potential to benefit from intervention. That includes the patient's diagnosis, age, prognosis, motivation, and functional goals. Critical period for skill acquisition or potential for regression. Therapist expertise needed. Level of support available to the patient and family. Family's compliance with attendance and with therapy recommendations. In this slide, we're going to learn about the 4 models of therapy and their frequency. TRACC 1 is intensive therapy. The frequency is 3 or more weekly sessions. TRACC 2 is weekly therapy, and its frequency is 1 or 2 weekly sessions. TRACC 3, periodic therapy, is 1 or 2 monthly sessions. TRACC 4, consultative therapy, is 1 session every 2 to 6 months. We also have trial therapy. Trial therapy is scheduled as needed and the frequency varies. Let's review TRACC 1 in more detail. It's for children who had surgery recently or have complex medical needs. Make fast progress towards short and long-term functional goals. May lose functional skills due to current medical condition. Need frequent changes to their plan of care. Need an intensive family education or training program. With their parents' help, they follow the given home program. Now let's review TRACC 2 in more detail. TRACC 2 is for children who were recently diagnosed with a condition or disorder, are making steady progress towards short and long-term functional goals, need occasional changes to their plan of care, and need education or training, and whose family follow the given home program. Now let's review the criteria for TRACC 3 periodic therapy model. TRACC 3 is for children who are making slow or limited progress towards goals, are achieving functional goals, need education and training with frequent updates, and whose families follow the given home program. The 4th TRACC model is the consultative therapy model. Let's review it. TRACC 4, the consultative therapy model, is for children who are slowly gaining functional skills, They require family education and training with infrequent updates, and the family follows the given home program. They are receiving community services and require occasional consultation with a therapist to ensure continued progress in the therapy goals or to address concerns. Additionally, they have specific new challenges identified by the child or family. They have a new need or will require updating of specific adaptive equipment, for example, wheelchairs, standers, gait trainers. What is the trial therapy model? A child may qualify for trial therapy model when therapy is given on a trial basis for a short period of time when 1. A new program or treatment approach is started, for example, alternative and augmentative communication or feeding and swallowing therapy. 2. The child is not meeting measurable goals or improving test results in a period of 12 weeks. 3. Child has a long history of therapy services as reported by the parents or medical records. 4. Prognosis or rehabilitation potential is fair or guarded. 5. The child is preparing to transition to therapy services in the academic or natural environment and/or alternative therapies. 6. The child is preparing to transition to community-based or extracurricular activities. 7. A home program is being used to maintain general skills within the natural environment. When do we put skilled intervention therapy on hold? Medical reasons, family choosing to stop receiving therapy due to inability to pay for services after being offered available hospital financial assistance programs and after being referred to community resources. After referral to other discipline before starting or continued skilled OT, PT, speech, or behavior therapy. When are evaluations and reevaluations performed? Evaluations are completed every 6 months. Information gathered during evaluation or reevaluation is used to create a plan of care according to the TRACC model, make treatment decisions and recommendations, and make plans for discharge. So we've been talking with the family from day one about discharge. So what is the discharge criteria? Therapy services will end when the needs and goals of the child have been met, the condition, injury, or disorder is resolved. The child can use compensatory strategies by himself. Evidence-based practices no longer result in measurable progress. Parents do not participate in therapy. Parents are unable to follow the attendance agreement. Family chooses to stop therapy or moves away. Child is referred to another provider or community resource. Family chooses to stop therapy due to inability to pay for services. Let's talk about the importance of attendance to therapy. In order for patients to receive the full benefit from the treatment plan, steady attendance is required. It is our policy that the child and family read and sign our attendance agreement before they begin therapy. A main goal of therapy is for parents and families to feel comfortable with guiding the child's progress. In order to receive the full therapeutic experience, the child and family must attend and take part in as many sessions as they can. Parents should learn how to follow home program orders. Cancellations may result in a lower number of sessions given per week or a change in the type of treatment given. If patients have trouble keeping scheduled visits, staff may give different scheduling choices. If the child attends therapy less than 80% of the time, and or the family cancels treatment sessions too many times, the therapy plan may change or treatment may end. We are dedicated to providing advanced care for children and their families. But how do we achieve this? We are committed to working with families to improve the child's functional outcomes. We are committed to using evidence-based practice guidelines for care. We are committed to providing family-centered care. TRACC was designed to create an individualized treatment plan for each child that tracks progress and outcomes through the time of care. Next, you will get some case scenarios to see if you can apply the TRACC service model correctly. Congratulations, you have completed this course. Now please do your final assessment to pass it.